Hey everyone, Dr. Lee here from Beeline Health. Today I want to talk to you about something that can have a lifelong impact on your child's health, getting their spine checked early for scoliosis and other spinal issues. This easily could be one of the most important things you do for their long-term development and wellness. So what is scoliosis? Scoliosis is a sideways curvature of the spine that often appears during the growth spurts right before and during puberty. So it affects about 2 to 3% of kids in the US, and most cases are considered idiopathic, meaning we don't always understand the cause. But what we do know is this: if left undetected, scoliosis can progress and cause pain, postural problems, reduced lung function, and emotional stress for kids, teens, and adults. So there's 3 different types of scoliosis. The most common is the one that we see in teens, which is called idiopathic scoliosis. There's also congenital scoliosis, which is present at birth, and neuromuscular scoliosis, which is often associated with conditions like cerebral palsy or trauma. So the earlier that we detect issues, the better the outcome can be. Studies show that early intervention, especially during growth spurts, can significantly reduce the progression of scoliosis and in many cases actually reduce the size of the curvature. So according to the Scoliosis Research Society, bracing can stop curve progression in 75% of children with moderate scoliosis, and adding in protocols like those of the Clear Institute, which is the new room in our office that we have certifications in, can be more than 90% effective. So we also screen for other preventable structural concerns, things like head tilt, shoulder imbalance, pelvic rotation, all things that can cause problems in your child's spine that can be corrected with early intervention, gentle adjustments, and specific spinal rehabilitation before they become lifelong issues. So if you're a parent, here's what you want to look for. You want to look for uneven shoulders. You want to look for one shoulder blade sticking out more than the other one in your child's back. You want to look for uneven hips from side to side, or a rib hump when they bend forward. You can even do a quick at-home test called Adam's Forward Bending Test. You can have your child bend forward like they're touching their toes, and you can look for any type of rib or spinal asymmetry from left to right. But ultimately, nothing beats a trained eye and a professional screening, and that's what we at Beeline Health offer. Spinal screenings are non-invasive, fast, and incredibly effective. If we find anything abnormal with posture, we can create a customized care protocol ranging from posture exercises to chiropractic care to functional rehab. Our entire goal is to help your child develop with proper alignment, better posture, and fewer problems down the road. So if you haven't had your child's spine checked, now is the time. Especially if they're between the ages of 7 and 14, growth spurts can create hidden problems that don't show up until years later. So call us or stop by our office to schedule the consultation. It only takes a few minutes, but could make an absolute lifetime of difference for you or for your child. We're here for you and your family to help you live your best life. Take care.